everyone, this is Marika and I welcome you all to this new session of nursing management. In our previous session, we have discussed about ward management, wherein we have seen the functions that are carried out by all the staffs within the hospital. We have discussed the function of the head nurse. We also discussed about the function of the ward in charge and also the function of the senior staff nurses. In this session today, we are going to discuss a very important topic related to ward management, which is factors influencing ward management. Now, we have to understand that managing a ward is not an easy task. There are so many different patients with different healthcare needs and different people working towards achieving the patient's satisfaction. We have nurses, we have doctors, we have other paramedical staffs, as well as class 4 workers. So, all of this employees within the hospital are working towards providing a quality care to the patient. Therefore, to manage a ward is not an easy task. As a nurse, we must have a proper idea about the factors influencing the ward management so that the ward can be managed effectively. In order to manage the ward properly, a proper coordination is required among the people working in the hospital or within the ward. The very first factor that affects the ward management is good knowledge of ward management, which means as a head nurse who looks after the entire ward, who manages the entire ward, I must have a proper knowledge on ward management. I must know what is ward management, how can I manage the ward efficiently, also have the capability to anticipate the problems that might arise in the ward, and also I must have the ability to solve those problems. The head nurse or the ward in charge must be well qualified, they must be well trained and must have a proper knowledge on ward management. Only if they have proper knowledge, they will be able to manage all the ward activities, they will be able to anticipate the problems in the ward, as well as they will be able to solve the problems that arises within the ward. The second factor that affects the ward management is a well-planned work schedule. So as I told, in the hospital, there are several different nurses working towards achieving the same goal. Therefore, skillful placement of the right person at the right job must be done by the head nurses in order to make sure that the goal is attained and the work that has been done, the care that has been rendered to the patient is effective. The work schedule of each and every employee within the ward must be planned properly by the head nurse as well as by the ward in charge. Planning of the duty roster helps to avoid duplication of work. It also helps to serve the patient in a better way. Another important factor for the ward management is work on time, which means the nurses, irrespective of their position, irrespective of what post or designation they are in, must come to their duty on time and must carry out their task effectively. We are already aware that punctuality is one of the most important parts in any human's life. So the job of a nurse is to provide care to a human being. Therefore, the nurse has to be very careful because any delay in their work, in the reporting time to the work, can cause conflicts between the nurses, and it may also lead to certain problems, life-threatening problems in the patient. Another factor that affects the ward management is disturbance or interruption in the nursing care. Now, various factors can lead to the disturbance or interruption in nursing care, such as absenteeism or sick leave of the nurses. So, nurses are allotted with a particular patient and they are expected to report to their duty on time as well as provide care to the patient effectively. Whenever there is any kind of absenteeism or whenever there is a sick leave taken by the nurses, then there can be a disturbance in the nursing care provided to the patient. So does that mean that nurses are not allowed to take leave? No. Leaves can be taken by the nurses, but we should always make sure that the patient care is not interrupted. As a nurse, if I'm allotted with one patient, I should ensure that even though I take leave, the care that my patient should receive must be received by the patient. Therefore, whenever leaves are taken by the nurses must inform the head nurse about the leaves that are taken so that she can arrange somebody to take care of the patient during the time of absenteeism. Another important factor affecting the ward management is continuation of ward activities. So to provide care to the patient, the nurse must continuously carry out all the routine activities within the ward. Now, routine activities within the ward may include taking over and handing over the duty shifts, recording the patient's detail and also reporting the same to the other healthcare members who are in contact with the patient, checking the cleanliness within the unit, within the ward, as well as making sure that the medications, the articles that are required within the ward are properly stocked, implementing the doctor's order, summarizing the patient details, handling telephonic calls, etc. So these are some of the basic routine activities that a nurse must carry out other than providing care to the patient. Another important factor in ward management is democracy in planning as well as scheduling. So whenever any work is scheduled, whenever any new plans, rules and regulations come up in the hospital, it is always communicated to the staff members and an approval from all the nurses is always taken so that the nurses working within the ward are well informed about the changing rules and regulations, schedule, as well as another important factor influencing ward management is orientation to the new joinees. So whenever there is a new employee who comes to the hospital, every organization is different, every hospital is different. Therefore, each of the new employee must get an introduction or an orientation to the hospital as well as to their respective job. Once a new staff is appointed, it is the responsibility of the head nurse to make sure that she is oriented to the rules and regulations of the hospital. Not just rules and regulation, the new appointed staff must also be oriented with other things such as organization and functioning of the hospital. So why is orientation required for a newly joined staff? For a newly joined staff, giving an orientation will help them to properly adjust to the new environment as well as to ensure that they perform their job smoothly and efficiently. Another important factor for ward management is being fair to all the staffs, which means the salary revision for the staffs, the reimbursement for the staffs must be done on a timely basis. So everybody works to earn their livelihood. Therefore, timely revision of the staff according to the workload, according to the responsibilities of the staff must be taken care by the head nurses. And the last factor influencing the ward management is maintaining the high morale, the respect and dignity of the employee. For any organization to function smoothly, to reach the target, it must always make sure to maintain the dignity, the respect and morale of the employees. I hope you've understood the factors influencing ward management. Moving on, let us see the criteria to be fulfilled for good nursing management. The very first criteria is that all the staffs working within the ward must work with team spirit. To work, to carry out any task, to meet any goal, the employees working within the organization must have the team spirit to work together as a team. So the very first criteria says that all the staffs within the ward must have the team spirit to work together. Second criteria is that the organization must always provide positive reinforcement for the talented staffs. Now, we've seen in a group of people, when group of people are working towards the same goal, social loafing can be seen. What is social loafing? Social loafing is when people know that task is being carried out by a group and therefore the task will be met by group people. So I as a member of the group will put very little effort because I know that anyway it is a group task and it will be fulfilled by other team members. To avoid such kind of things, to avoid social loafing, talented staffs must be always awarded with positive reinforcement. Another important criteria for a good ward management is to make sure that the working environment is good for all the staffs as well as the salary and the reimbursement provided to the staff is proper. Another important criteria to be fulfilled is to follow unity in direction and unity in command. Now, the unity in direction and unity in command, as we have discussed in our earlier session, we are already aware that when the direction and command comes from a single source, then it becomes easier for the subordinates to function. We have already discussed about this in our previous sessions. For a good ward management, unity for direction as well as unity for command must be followed. Following this principle will help to provide quality nursing care. Another important criteria is that there should be strict observation for the implementation of nursing care. Whenever nursing care is being provided to the patient, all the rules and regulations to be followed, the principles to be followed while providing the nursing care must be looked after. The head nurse should always make sure that the nurses are providing care to the patient in a proper nursing approach, following all the principles, the rules and regulation that a nurse must follow. Another important criteria is organization of medical and nursing audits. It is the responsibility of the entire organization to ensure that the medical as well as nursing audits are being conducted on a regular basis. The next criteria is providing the introduction and the orientation to all the newly joined staff. This we have discussed as one of the major factors influencing the ward management as well. It is also one of the important criteria to be met for a good nursing management. Next important criteria is provision of in-service and continuing education for all the staffs. This also we've discussed as one of the major objectives of the hospital. In-service education and continuing education has to be provided in each and every hospital to improve the knowledge, to improve the skills of the nurses. As we know that technological advancements takes place in our profession. There are various new researches that are being conducted. The knowledge of the staffs must not be limited to what they have already studied or to the exposure that they are getting only by treating the patient. Always in-service education and continuing education must be provided to improve the skills as well as the knowledge of the nurses. Another important criteria is a guidance and a counseling center or a unit must be established within the hospital to resolve the problems, the conflicts that may arise in the working environment. So in our hospital, as we work with different people with different thoughts and individual differences, there is a chance that conflict may occur. Therefore, a guidance and counseling unit within the hospital helps to solve any kind of problem that may arise in the working environment. And finally, the last criteria is to have a person who is knowledgeable, a person who is skillful and has a proper idea about the entire management process. So as I told in the very beginning, managing a ward, managing a hospital as an organization is not an easy task. Therefore, trained and talented administrators are required to see the entire management process of the hospital. These are the various criteria to be fulfilled for a good nursing management. So that is it for today's session. In this session today, we have discussed a very short and an interesting topic, which is factors influencing ward management. I hope you've understood the topic, and I'll see you all in the next session where we will discuss about emergency and casualty. Thank you and have a great day ahead.